effective signposting to community optometry practices. Welcome, Bob. It's a real pleasure to have you with us today. So should we jump in a few questions? So tell me, what does a good GP optician team work look like to you?
Well, we get quite a lot of referrals from GPs locally, to our services, like the Q service we offer, for instance. I mean, just this morning, I've had a patient advised by the GP to come and see me with possible wet AMD. It turned out, thankfully, she didn't have that. But that was the lady who had a lot of problems with having trips. She'd broken her neck actually recently. And she has also got a bit of cataract, but it's early enough not to be treated. So we can help with the referral from the GP or the signposting from the GP. And I think GPs really love the service that we offer because it does enable them to get the patient seen by us. And then, if they need to be referred to hospital, we can do that, or we can certainly do a certain amount of treatment on our own as well. Because of 80% of the patients we see, we can manage in primary care and avoid hospital appointments.
And that's really important, isn't it? Especially moving towards that INT model as well, getting people closer to home. We've got some slides for you. Shall we put them on the
it might be
screen
helpful.
now,
Yeah.
Bob?
Okay, so that's just the lead one. So you go on to the next one if you can for me.
Great.
Because the next one we're going to talk about. So this
is about how optical practices manage eye conditions better.
So this is the basic service that we would offer, the general ophthalmic service, or what would be known as the eye test, the NHS eye test. It isn't a universally free service. Anyone up to 19 would get the service, but from about young adulthood up to 60s, it wouldn't be free. So you'd have to pay for a private test, most people. Although over 60, you get a free eye test. There are certain circumstances which I've put on the presentation there that where you might get entitled to a free eye test, things like registered partially sighted or wearing very strong glasses, benefits of course obviously, and that can also give you some benefit in terms of the spectacles as well. But it just needs to be made aware that whilst quite a lot of our services that we do at NHS, the standard eye test was only for certainly exempt groups, of course. So if you go on to the next slide for me. So these are more the local enhanced services. So the one that most people would know is Q's, now known as Community Urgent Eye Service, although it was initially came in as COVID Urgent Eye Service to transform services during the COVID era. We had a service going back over 10 years now called Minor Eye Care Service, and in Sefton, for instance, they have both of those services running. But ours really is more like the MEX and the Qs together, really, in our central Mersey area. The only one place we don't have a service of that kind is in Liverpool. They don't have any service of that kind there, so there would be no option for. So that covers a lot of the stuff that we do. Patient having urgent eye conditions, and we would examine the patient and refer where necessary. So we've expanded that a little bit now. We can do things like take out ingrowing eyelashes or foreign bodies, and things like that, of course. Then we do, where necessary, a pre-op assessment for cataracts, and refer the patient or keep them monitored in the community. We have, to some extent, various versions of glaucoma referral refinement in Cheshire and Merseyside. We're hoping to expand that into a slightly more thorough service to again avoid even more patients needing to be referred to hospital. In some circumstances, we have cataract post-op, particularly with independent sector providers. The most well-known one locally is called Spa Medica, and there's one called Check and Aces as well. And there's actually one called Eyesight up in Southport, but they don't actually have a follow-up. And then Liverpool hospitals, and I believe also in Cheshire, I think Leighton Hospital particularly does a follow-up. So if we see the follow-ups, we only have to refer back in around about 5% of cases. So 95%, in other words, are managed in the community, and that's helps the hospitals to get through the numbers of cataract surgery, of course. We then have two services that are universal across the whole patch: an easy care learning disability service, and we have a blood pressure check. In fact, with easy learning disability, there's like a a service done in practice, and there's also a service done in school environments for that as well. But they're not, although they're universal, they're not quite as well established, and the blood pressure checks is actually only in a pilot form at this moment in time. And then there are other things we could be looking at, but obviously our discussions with the commissioners are tending to hit brick walls a little bit at the moment, I'm afraid, because of the financial condition. But we hope to, have some productive discussions in the future. If you can go on to the last slide then for me. Okay, so we've had a pilot single point of access that started in July 2024, finished July 25, and has now made a comeback. And it was on our patch in central Mersey and parts of Cheshire, but it's now from this month, it's now extended to all parts of Cheshire and Merseyside. And we've had a full year analysis of the initial pilot scheme. So it involves triage of electronic referrals to secondary care ophthalmology. Majority have been optometrists, but there still are a few GPs would refer some eye conditions to hospital. Initially, in the initial pilot, we didn't quite get that bit sorted enough, but we've improved on that now. And I think with the current service now, so GPs should really refer to this triage, and there are information out there for them to be able to do that. Because what the outcome, particularly with the GPs, is that a lot of these are then deflected to the local enhanced services, at least where we have them, because as I say, they're not absolutely universal across everywhere. It may lead to the referral just being completed onto the provider that the patient has chosen. Although after that, the patient gets a choice of where they want to go to. The referral may be rejected, asked for more information before it's sent on, or occasionally, in a very small number, it was completely referred because it was felt to be inappropriate or necessary. So, as we've said already, this is transformed hospital to community. And the future commissioning plans hopefully will influence that, because the analysis found that 1,600 appointments were saved from going to hospital and managed in the community in primary eye care.
That's a huge number, isn't it?
Yeah, and that wasn't across the whole of the patch as well. It was only in about 5 areas as well. So, it will extend out to the whole of the area now, and that number will be quite a lot larger, of course.
And I'm guessing better patient satisfaction, because they don't have to go into hospital. All of that other stuff that comes with
very popular.
Those numbers. Yeah.
We got very high patient satisfaction ratings. We really do with that. Yeah, very high indeed, and get a lot of good comments about the service and the practices as well. So it's popular.
I remember being referred, like you said, during COVID time, and I thought the service was brilliant, and one that I didn't know as a patient did exist either. And when you do speak to other people and they're having similar issues, you pass that information on anyway, don't you? And then they start asking the questions. So it is a little bit of an unknown service, as you said, until COVID.
That's the only problem. We still get the odd patient where they've been to the GP, say, or they've been to the pharmacist, or sometimes this pharmacist, then to GP, and then eventually the GP will send them to us. And it'd be nice if they could just refer the patient to us in the first place, really, because sometimes we're having to change treatment that they've already been started on.
Yeah. So now we're touching on that. What does that better communication look like between you, the hospital, eye departments make for a smoother patient journey, and they're not bouncing backwards and forwards to people?
Well, they can just signpost patients to us, and we have done a little bit of that in Halton, particularly. We did a signposting system there to make GP practices more aware of the service, because it is easier. I mean, it would be helpful sometimes if we could get a letter off the GP or whoever else is referring, because sometimes, obviously, we're getting the information off the patient, which isn't always perfect information, is it? So it would be quite useful to know that if we can, but so as it doesn't get sort of like slowed down, certainly just referring the patient or signposting them to us would be fine, really. Be happy enough with that, really. But if there is a particular concern, it would be helpful if we could have that in writing, if that's possible.
Yeah. The last question then, Bob, before we're going to stop recording and then we'll take people's questions, is, have you got any guidance for those referring or recommending patients to primary eye care?
Well, there is a Find a Practice website which works really well, so they can go on that, and then the patient can be directed to wherever nearby does the service. and it gives information for the patients as to what the service offers. You know, well, the only thing, again, what we need to be a bit careful of is one or two. Sometimes people will say it's a drop-in service. Well, it isn't really a drop-in. We do ask people to ring if they can, mainly because they don't get disappointed. We can usually see them fairly quickly, but if they just literally come through the door, we might not be able to see them at that point. But if they ring, it means when they come, they won't probably have to wait very long at all. Then, you see.
A great service.
Yeah.
Well, we're going to stop recording there, Bob, but I've got a couple of other questions, and hopefully people will put theirs in the chat. It just makes it for a more